Hello, hi everyone. Sorry, apologize for my casual attire today. I've been working at one of our clinics. We're using our new public health response unit today at Keeler. It's very exciting. We just got it last week and we were very happy to put it to good use. It was funded through the Centers for Disease Control, Epidemiology, and Laboratory Capacity Grant that passed to us from the Alabama Department of Public Health. So it's hot out there, but we're making do. All right, I'm Rundy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department, here to give you our update on the impact of the COVID-19 pandemic on Mobile County, our residents, visitors, and workers. Today is Thursday, August 19th, and we're reporting on a cumulative number of COVID-19 cases at 58,753. 436 cases were added yesterday. So although we are still at an extremely high rate of COVID transmission in the county, still higher than anything we've seen, I hope that it is starting to plateau somewhat. But again, we're still holding our breath and asking everyone to stay the course with the prevention measures, because we're a little nervous about what the impact of going, schools back in session, the Labor Day holiday coming up, and then, football season starting. Those things are likely to create another surge in COVID cases unless people are, wearing their mask and distancing and getting vaccinated. So again, 436 cases added yesterday. We learned of 9 new deaths yesterday. That brings our cumulative number of people who have died with COVID to 954. So 9 deaths. And remember, that doesn't necessarily mean that they died in the last 24 hours, but they probably do have dates of deaths in the last few days or weeks. And then 59 more people were admitted to Mobile hospitals yesterday. That brings the cumulative number of people hospitalized with COVID to 7,286. So in the hospital yesterday were 473 people. That is slightly lower than the day before. So I have talked about, things are not getting better. We still have record numbers of cases, record numbers of hospitalizations. Our deaths are starting to pick up, and it's probably going to eclipse anything we've seen in the past. I was asked about yesterday, I think I made a comment about looking at projections, and had to go back and look at the website that we were looking at last year to see sort of what is projected for our county. And if you want to go and look yourself, Google IHME COVID-19 projections, and that will take you to the website where you can look at projections all over the world and any U.S. state. So these are projections for the whole state, not just for Mobile. But if you look at the IHME COVID-19 projections, it looks like our daily infection rate we're probably pretty close to the peak there. Hospital resources, so like the burden of COVID-19 on our hospitals, we probably are 10 to 14 days away from the peak number of hospitalizations. And for deaths, we're probably 2 to 3 weeks out from the peak number of deaths in the state of Alabama. So this wave, Mobile County was slightly ahead of most of the other states. That's sort of backwards from where we have been in previous waves. But so maybe our peaks will be a little bit earlier than those that are projected for the entire state, but only time will tell. And remember, you can help us slow it down by wearing your mask, distancing, and getting vaccinated, staying at home if you're sick, so that you are not transmitting COVID. For normal COVID, one person could maybe infect 1 or 2 others. For Delta COVID, which is what we have now, one person may infect up to 4 to 5 people. So staying at home is even more important now than it was some time ago when we had our previous waves with Alpha and Delta. So a couple of questions, should have try to get through these quickly. Someone is asking us that they heard from another TV station that a strike team is going to assist Baldwin County hospitals in the next 24 hours. I assume you're talking about a federal asset. I'm wanting to know, has Mobile requested similar assistance? Yes, we have made, when I say we, us, some hospitals, the city, we have made requests through the State Emergency Management Agency for federal assistance for healthcare providers to assist in this area. And so far, none of our requests have been filled. So you probably know the White House vaccine lead was in the state, I think earlier this week. We're talking with meeting with the mayor, meeting with the state health officer, assessing the situation and making some decisions about where, if any, federal assets will be mobilized in Alabama. So we have made several requests, but we've not heard if any of those are going to be filled. As you can imagine, with all of the states being in high risk, that there are requests coming in from probably all over the United States, and the federal government cannot fill every request. So we'll continue to wait to hear to see if any of those are filled. All right, some more questions asking about, can you mix the vaccines? And actually, I think the reporter that submitted this actually answered the own question, that CDC says on their website that when you go to get a third dose, that you should get the same vaccine. So if you got a Pfizer first and second dose, you should get a Pfizer third dose. If you received Moderna first and second, that you should receive a Moderna third dose. But if you come to our location and you don't know what you got, or you're not sure, then we will look it up in the state registry to see if we can identify what product you got, either Pfizer or Moderna. If you got your vaccine someplace else, CDC has said that, like, let's say they got it in another state and we don't have access to that registry, then CDC says that if the vaccine product is not unknown for the first 2 doses, then you can give either the Pfizer or Moderna, because they are both a messenger RNA vaccine. All right. So another question with school football starting, are we concerned that it's going to be an area for COVID spread? Yes. We talked about this last year. It's not just football. It's any extracurricular activities, any sports, any gathering where physical distance of 6 feet or more and masking cannot be maintained. So we are extremely concerned about school being back in session and extracurricular activities taking place. The mask mandate that was initiated by the Mobile County Public School System, I think, includes in-classroom settings and buses. I don't remember exactly what it says about football and cheerleading and all of that, but I think it recommends masking when it can be tolerated, but does not require masks mandates. So we are going to see lots of transmission in schools, lots of transmission among cohorts or groups of people, and it will be interesting to see going forward, since the full football schedule has been published and I think everyone's hoping that they can carry out a full season this year. I suspect, like last year, we will see games being canceled because, teams have so many folks out either with COVID or exposed to COVID. So that is, we're concerned about it. All right, what would be our recommendations for high school football with mask wearing, et cetera? So again, teams need to think about cohorting their players during practices and during games, right? So let's say if you have a first string defense and a second string defense, right? So think about keeping your first string together and keeping your second string together, but not mixing them, so that if you have somebody on your second string that gets COVID, your first string is not impacted. Last year, we had several situations where they tried to keep them separate on the field during practice, but then they went into the weight room together, and they didn't stagger them in the weight room or stagger them in the dressing room so that they could keep those cohorts intact. So there are some things that you can do to try to minimize the impact of COVID on your team when it happens. It will happen. So again, just making sure all your coaches are vaccinated, trying to make sure all your athletes that are 12 and over are vaccinated, and then doing things like seating charts and cohorting and those sorts of things with the players. Now, with the coaches and the stands and the bands and all of that, that also you need to consider, requiring masks for people who are in the stands, limiting occupancy so that they can spread out. Those sorts of things that will slow the spread if you do have it, so that you don't end up having an entire, we are hearing schools having 20% positives in their schools or in their athletes, which can just almost immediately shut down the entire program. All right, already talked about the models. I do not know if morgues are full. I know that we have had a large number of deaths, of COVID deaths. I don't know what the situation is at morgues right now. All right, so someone's asking me here, when I'm talking about treatment for COVID, why do I only talk about the antibody treatment and I don't talk about things like ivermectin or vitamins? And it's because I don't have any FDA, authorization for those as a treatment against or to protect or to heal COVID-19 infections. The only treatments that are FDA authorized are the antibodies, the remdesivir, and convalescent plasma. If vitamins work for you to help boost your immune system, to help you build protection against COVID-19, then certainly do it. Ivermectin is not recommended in any form for the treatment of COVID-19. It is recommended for treatment of other ailments, but it is not FDA authorized for the treatment of COVID. So, and then someone sort of pushing me further on this semantics about FDA approved or FDA authorized. So the monoclonal antibody treatments, the remdesivir, the plasma convalescent, those are FDA authorized. The vaccines are FDA authorized. That's all we have right now. We're waiting on FDA approval for the vaccines, but we don't have it. So the drugs we have and the vaccine we have are FDA authorized. Can vaccinated people still get the monoclonal antibody treatment if they get COVID? I think the answer to that is yes. So that if you are vaccinated and you have a breakthrough infection and you fall into those categories for, having the potential for having severe illness, if you get COVID, then I believe that you can still get the monoclonal antibody treatment. A question about mask mandates. Can the city or county mandate masks? So municipalities, city governments have, authoritative power to do things like close streets and enforce curfews and require masks and reduce occupancy and those sorts of things. The counties can do similar things. The health department usually does not have the authority for a mask mandate. We can make a very strong recommendation, but again, usually with a mandate that you think about that requiring some sort of enforcement, the health department doesn't have an enforcement arm. Okay. Someone asking about the 10-day rule. Is it 10 days post symptoms or 10 days after onset of symptoms? So if you get COVID, you need to stay at home 10 days from your first symptom onset. So after 10 days, after your first symptom onset, you can discontinue isolation as long as you are well, like have no fever and all of your other symptoms have improved for the last 24 hours. So if I started coughing today and I test positive in 2 days, the 10 days of isolation would start 10 days from today. So tomorrow would be day 1, day 2, day 3. All right. Are there plans of putting up off-site hospitals? Not that I know of. There have last year, or last December and January, when things got really bad, the hospitals we talked about, do we need to, stand up like in the parking lot, triage, or hospitals, or a temporary hospital? And the consensus at that time was no, we're doing okay. This was last December and January. Things are much worse this time, twice as bad as they were then. So far, we're not hearing of hospitals requesting additional beds. What they need are staff. I think they feel like they have the space and the beds and the stuff. What they are struggling with is keeping keeping people on payroll to staff those beds, or finding enough people to staff those beds. Let's see. Does the vaccine wipe out natural immunity if you have COVID? No. So a vaccine is not going to wipe out any natural immune cells that developed from a natural COVID infection. Should someone with COPD take a third shot or just two? So talk that over with your physician. And again, if that COPD puts you in a situation of being moderately or severely immunocompromised, then you qualify for a third dose. Someone asking, why are so many people getting pneumonia without COVID lately? Are they just getting false negatives? I'm not sure. We have seen a lot of RSV in adults this summer. So it could be that there are other respiratory conditions that are causing people to have pneumonia, even though they may be testing negative for COVID. Right now, the tests that we have for COVID are pretty accurate. So with this much transmission in the community, it would be rare to get a false negative for with any of the tests that we're using in someone that is symptomatic. Now, pneumonia can be sort of a long-term sequelae of respiratory infection. So it could be that you get a bacterial pneumonia later on. Maybe you had a COVID infection, a couple of weeks ago, and because you were very sick and your immune system couldn't fight off, you maybe got some other infections. So that can always happen, and maybe by then it was kind of a long-term, side effect of having COVID, but by then you're testing negative. All right. I think that's it for today. Okay, so I think what we'll do is stop here for now. Just continuing to, continue to have conversations with your friends, with your colleagues, with your neighbors about the importance of vaccination and trying to get people vaccinated. And again, try to be a steward for good health and wear a mask when you're out, when you're around people that you don't know, and socially distance so that we can hopefully start to see the numbers of cases go down. It's going to be several weeks, probably into October, before we have an opportunity to see things, drop as low as we saw in June. So this one's going to be a long haul. I know everyone's tired, and we wish that we could go back to June when we were all exhaling a little bit, and those of us that were vaccinated not wearing our masks outdoors or indoors. But unfortunately, just not having enough of our community vaccinated, the Delta variant just took such strong hold in our community, and it's going to take us a while to get out of this mess. So again, be safe, wear your mask, distance, and get vaccinated. We'll talk again tomorrow.